Acute coronary syndromes, or ACS, strike men and women, often after years of coronary atherosclerosis and plaque formation. Within the heart, as plaque forms, several clinical syndromes may also develop, with varying degrees of coronary artery occlusion. Two of these syndromes are unstable angina, non-ST segment elevation myocardial infarction, or UA-NSTEMI, and ST segment elevation myocardial infarction, or STEMI, which develops after a clot significantly or completely occludes the coronary artery. Either of these syndromes can cause sudden cardiac arrest and death. It's estimated that 70% of the deaths from these syndromes occur outside the hospital, making early recognition and rapid response essential. Welcome to the American Heart Association Acute Coronary Syndromes video. This video follows an evolving STEMI case from the moment symptoms begin through treatment following the ACS algorithm. Watch how emergency medical services, or EMS, and hospital personnel use the STEMI chain of survival to provide a system of care that recognizes and rapidly treats the underlying causes of ACS.
Hey guys, it's crazy.
Morning, hey, you. How are you?
Okay, I guess you.
Hey, we got your favorite donuts. Want one?
No, not now. I'm not feeling so great. A little heartburn or something.
Hey, suit yourself. More from me.
Yeah.
You must be feeling bad and turned out donuts. Can I get something else for you?
I've actually got some acid. Thanks. No, I'm sure I'm going to feel better once we get going this morning.
Oh, yeah.
See you in a minute.
All right.
Oh, man. What's wrong? My back and my chest. All of a sudden, it's like an elephant sitting on my chest. I gotta sit down. I feel a little dizzy.
Let me help you, man.
Besides nausea and dizziness, the symptoms of ACS can range from jaw and neck discomfort to a squeezing pressure in the chest that may spread to the back or down the left arm. Significant obstruction within a coronary artery may result in a STEMI. This obstruction deprives the heart muscle of blood and oxygen, which can lead to irreversible heart damage or death if not treated promptly.
I'll be fine. You all right? Yeah, I just gotta catch my breath.
What's wrong?
He's not feeling well. He says his chest hurts and he's feeling dizzy. Oh, man, it's killing me.
You know, he hasn't been feeling good since he got here this morning. You think maybe it's a heart attack?
Might be. I'm calling 911. Go grab the AED and first aid kit out of the break room.
911, what is your emergency?
I think one of my employees is having a heart attack.
I see you're located at 459 Industrial Drive. Where's the patient?
He's right here. He's complaining that his chest hurts and he says he's lightheaded, kind of dizzy.
Is he awake? Can you talk to him?
Yeah, he's awake and able to talk.
I'm going to dispatch paramedics to your location.
The first step in the ACS algorithm involves the patient, bystanders, and medical personnel recognizing the warning signs of cardiac ischemia. Trained emergency medical dispatchers should use triage protocols to identify patients suffering a possible ACS. Dispatchers who suspect a heart attack should send help immediately. While waiting for EMS to arrive, dispatchers may advise patients to chew 160 to 325 milligrams of non-enteric-coated aspirin. This recommendation should be in line with approved medical protocols, and only if the patient has no history of true aspirin allergy or gastrointestinal bleeding.
Paramedics are on their way. Stay on the line with me until they arrive. Do you have a first aid kit with you?
Yes, I do. And I have our AED too.
Great. Is the patient still conscious?
Yes, he is.
Okay, we don't need the AED right now. Ask him if he's had an aspirin allergy or if he's had recent bleeding from the stomach.
Hugh, are you allergic to aspirin?
No.
Have you had any bleeding from your stomach lately?
No, I haven't.
No to both questions.
Look in the first aid kit. If it has some aspirin, have him chew 2 baby or 1 adult aspirin while you wait for the paramedics to arrive. Do not give him coded aspirin.
Time is ticking for the ACS patient as emergency crews arrive. EMS personnel should assess, provide early management, and initiate transport as soon as possible. Increased out-of-hospital time may worsen the patient's outcome. That brings us to the next step in the ACS algorithm: assessment, care, and hospital preparation.
What happened?
Well, he began having chest pains a few minutes ago while working. He's chewed one adult aspirin. That's what the lady on the phone told us to do.
Sir, how are you feeling? Not good. It hurts. Feels like someone's squeezing my chest.
Okay, we're going to help you out and reduce that pain, okay? Let's get his blood pressure and oxygen saturation.
As providers treat the patient, they should be prepared to provide basic life support, including CPR and defibrillation. Half of the patients who die from ACS do so before arriving at a hospital. Supplementary oxygen should be given if the patient's oxygen saturation is below 94%. Administer aspirin if the patient hasn't taken any yet and there are no contraindications. It's critical that healthcare providers quickly obtain a 12-lead electrocardiogram. This pre-hospital ECG helps classify the patient into one of 3 groups based on ST segment deviation before they reach the hospital. Studies show that this initial ECG speeds the patient's diagnosis and shortens the time for reperfusion. Recognizing ST segment elevation on a 12-lead ECG takes training and practice because different thresholds exist for patients depending on their age and gender. For ongoing symptoms of ischemia, administer nitroglycerin tablets or sprays every 3 to 5 minutes up to a total of 3 doses. Monitor the patient's blood pressure between each dose. Before giving nitrates in any form, make sure that there are no contraindications, such as severe bradycardia, tachycardia, or hypotension. Also confirm that the patient hasn't taken any phosphodiesterase inhibitors for erectile dysfunction in the last 24 to 48 hours. Right ventricular infarctions often present as inferior wall STEMIs on a standard 12-lead. For these patients, healthcare providers should acquire a right-sided 12-lead to evaluate for right ventricular or RV infarction. If RV infarction is present, nitrates in all forms are contraindicated. If RV infarction cannot be confirmed, providers must use extreme caution when administering nitrates. If the patient receives nitroglycerin but does not experience pain relief, healthcare providers can consider giving morphine while monitoring the patient's blood pressure and respiratory rate. Use morphine with caution for patients with unstable angina. If a STEMI is suspected, EMS should notify the hospital or transmit the ECG for interpretation.
County Medical, this is Rescue 1. We have a STEMI alert. 57-year-old male, chest discomfort started about a half hour ago. His recent vital signs are BP 104/78 millimeters of mercury. His heart rate is 96 per minute and his pulse ox is 95%. He chewed a 325 milligram aspirin and received 2 sprays of nitroglycerin, but is still complaining of chest discomfort. The 12 lead shows ST segment elevation of 3 to 4 millimeters in leads B1 through B4. Our ETA to your facility is 10 minutes.
Rescue 1, the emergency physician's here and heard your initial report. We'll activate the heart alert system, notify the cardiologist and the cardiac cath team. We'll see you in a few minutes.
The American Heart Association recommends that EMS personnel transport patients suffering from a STEMI to the closest appropriate facility that provides reperfusion without delay. With this advanced notice, hospitals can speed treatment of these patients, increasing their chance of survival.
Did you get the ECG?
Yeah.
After we last talked to you, we administered 1 more spray of nitroglycerin. Pain's down to 2 out of 10. Other than that, he's stable.
Yeah, looks like a STEMI. I've activated the PCI team and alerted the cardiologist. Sir, I'm Dr. Green, your emergency physician here. We're going to be getting you into a room and getting you checked out. Okay, go.
When the patient arrives at the ED, we move to the next step in the ACS algorithm. Reperfusion goals for STEMI patients include percutaneous coronary intervention, or PCI, within 90 minutes of arrival, and fibrinolytics within 30 minutes of arrival. The appropriate therapy is defined by patient and center criteria. Within the first 10 minutes of arrival, the ED staff should provide an immediate assessment of the patient. This includes checking vital signs, obtaining a brief targeted medical history, completing the fibrinolytic checklist, and obtaining blood studies, including electrolytes, coagulation tests, and initial cardiac markers. The staff should also obtain a portable chest x-ray within 30 minutes of arrival.
Let's get some stat blood work, CBC, coagulation studies, electrolytes, cardiac markers. Get radiology staff for a portable chest x-ray. I paged cardiology and we'll let them decide on the adjunctive therapies. Mr. and Mrs. Young, I've asked Dr. Redmond to come up. She's an excellent cardiologist. She'll be consulting with you, so you'll be in very good hands with her. Okay? All right.
Adjunctive treatments include continuous nitroglycerin infusion, unfractionated or low molecular weight heparin, beta blockers, clopidogrel, and glycoprotein inhibitors. For a STEMI patient, time is critical. The longer the delay to treatment, the greater the amount of myocardial damage. Studies show ED evaluations are responsible for as much as 33% of the delay in time to treatment.
What have you got? You page cardiology?
57-year-old male, ST segment elevation of 3 to 4 millimeters and leads V1 through V4. No contraindications for fibrinolytics. He's been in the ED for about 15 minutes. MI started about 45 minutes to an hour ago. He's had 325 milligrams of aspirin and received 3 nitroglycerin sprays.
Yeah, looks like a clear case. The CAT suite's already been notified. They're prepping for primary PCI now.
The final link in the STEMI chain of survival is treatment. The preferred reperfusion strategy for STEMI patients is percutaneous coronary intervention, when patients meet the 90-minute window from ED arrival to balloon inflation in the catheterization lab.
Hi, Mr. Young, Mrs. Young. How are you feeling?
I felt better.
Yeah. Well, I'm your cardiologist, Dr. Redmond, and I want to talk to you a little bit about what's going on, okay? I've reviewed your test results, and it appears that you have a blockage in one of the arteries to your heart. To open up the arteries, we need to do a procedure called PCI that's going to help reestablish the blood flow to the heart. The sooner we do the procedure, the less damage that may be done to the heart, okay?
Okay.
I understand that Dr. Green has already discussed the procedure with you. Do you have any questions for me?
No. I understand. I'm ready.
Okay. We're going to take good care of you. I'll see you in the cath lab.
Thank you.
Okay. Now what are we doing next?
PCI opens the blocked artery with a tiny balloon. Then a stent or metal scaffold is inserted to maintain blood flow to the heart. When choosing between this reperfusion strategy and fibrinolytic therapy, hospital personnel must consider a number of factors. Studies show that treatment delays increase mortality in both groups, regardless of the reperfusion strategy chosen, but were more pronounced among those patients receiving fibrinolytic drugs. In these cases, the more time that goes by, the more heart muscle that is lost. The better EMS systems and medical centers work together, the faster they can deliver treatment, the more heart muscle and patients can be saved.
Hey, guys, it's you. Hey, good to see you. Good to be back.
So how you doing? Did you make it through it okay?
Yeah, no, I mean, it was a heart attack. They said I had some big blockage, and the doctor saved my life. But they said you guys got the credit for recognizing I had a heart attack and calling as quickly as you did so they could help.
Hey, we're just glad to have you back. You're looking much better, buddy.
Yeah, well, the docs told me to lay off the donuts. My wife's got me eating right, and she makes sure I take a daily walk.
Oh, wait, I don't believe it. Well, guys, we should probably get to it. Hugh, we'll see you in a minute, buddy.
It's great to have you back.